Hello friends, we will be seeing about chronic calcific pancreatitis. Though the name is very fancy, it is very easy to understand. I'll just split them into individual words. Chronic means which is happening over a prolonged period of time. Calcific means deposition of calcium stones, and pancreatitis, it is self-explanatory. This happens in an organ called as pancreas, and itis means swelling. So when you put together, due to calcium deposition or stone deposition, the pancreas gets blocked and it causes swelling of pancreas, and this happens over a period of time. So it is called as chronic calcific pancreatitis. Unlike acute pancreatitis, which happens more commonly after binge of alcohol or due to block of a gallstone, chronic calcific pancreatitis usually presents like intermittent episodes of severe upper abdominal pain which is radiating to the back. And if this is ignored and it happens over a period of time, we all know the function of pancreas are mainly two. One is for digestion of fat food, second is maintenance of blood sugar. So what happens when stone blocks pancreas for a prolonged period of time? The pancreas gets digest itself. So the functional unit of pancreas comes down. Whenever we take fatty food, the enzymes required to digest them actually comes down because pancreas loss is there because of stone and block. So we tend not to digest fatty foods and we start passing fat without digestion through our stools, which we can see as floating fatty stools on the closet. Second, the patient will start developing diabetes because insulin and its other hormones are secreted in the pancreas, and when stone blocks pancreas, there is a loss of pancreatic function. So if it is identified at an earlier stage, if pain is the only condition, then it can be treated with drugs initially, or it may require certain other intervention. Now, what are the conditions that will cause chronic calcific pancreatitis? It can be caused by a congenital or genetic condition, it can be caused by alcohol, or it can occur as a result of an autoimmune condition. Autoimmune means immunity, the defense mechanism against outside bacteria. Due to certain reasons, it may act against our own body. In this condition, it may act against our own pancreas. So we saw about the risk factors, we saw about the symptoms, how to diagnose them. So basic ultrasound screening will give us an idea whether there are some stones in pancreas or there is decrease in the pancreatic size. But exact idea will be gotten with the help of a CT scan. So how can we find fat presence in the stools? There are certain special tests of stools which will identify excessive fat presence in the stools. Even before, we can literally see stools floating in the closet because of fat. Now, treatment includes certain drugs which will reduce the inflammation or swelling of the pancreas. If it is autoimmune, we can start certain specific drugs to reduce the repeated episodes of autoimmune pancreatitis. If it is due to alcohol, discontinuation of alcohol may put a stop of progression of chronic pancreatitis, but if it is due to genetic condition, we cannot be able to stop it. Surgery, is there any role? Yes, surgery, if the pancreas is continuously blocked with a single stone, it can be tackled with an endoscopy by removing a single stone, or if there are multiple stones which are spread throughout the pancreas, then in surgery we remove all the stones. In addition to removing stones, what we do is we directly join pancreas with intestine. It is called as pancreaticojejunostomy. So that way we reduce the pain, and at the same time we also bypass the block of pancreas. Is there any other risk other than development of diabetes? When this chronic pancreatitis is present for a prolonged period, and if it happens in a particular ethnic group, then 1 to 2% of the people can develop a pancreatic cancer. So how to avoid them and how to prevent them? Get yourself screened regularly. If you are a known case of chronic pancreatitis, get ultrasound scan regular period of time. Sometimes you can develop jaundice, which can be a telltale sign of cancer. Not all patients who have jaundice with chronic pancreatitis are due to cancer, but sometimes it may be due to it. So once you develop jaundice, promptly go to a doctor, get yourselves screened, get yourselves imaged, and see to that whether it's a cancer or it's just stone blocking the bile duct also. So chronic calcific pancreatitis is not a very common condition, but we saw today what happens when chronic calcific pancreatitis happens. Thank you.